years, we have been working to try to eradicate the barriers that people find when they're trying to apply for federal nutrition programs. In the case of SNAP, we've been doing that through the resource hotline and through our gettingsnap.org website, as well as through the number of people or counselors that we have in the field directly helping people apply for benefits. So what we have learned through all of these conversations and focus groups and individual interviews is that there are a number of self-imposed barriers that people have to participating in the program. And an example of that is for seniors. Many of them have been working very hard all of their lives, and they reach a stage in their life where they think of SNAP or food stamps as a government handout, and they're not ready to apply for that just yet. So what we do, or what our staff does, is try to help them understand that it is not a handout, that they have been working hard, they have been paying taxes, and they have a right to expect some help when they need it. We try to help them understand that it's a health and nutrition program, and that it's there for them to use, again, as they need it. Also, we hear a lot that they would rather not apply because they want to leave it for someone else who needs it more. And that's an actual quote. And we get that a lot. Again, people who call the hotline, people who talk to our staff. We have done a number of focus groups. We go to senior centers and residence homes, and we hear that a lot. And then our staff tries to help them understand that it's an entitlement program, which means that it's there for anyone who is eligible, and accepting it doesn't mean that they're taking it away from anybody else. But there's that layer of education and helping them understand that they're not harming someone else by deciding to apply for benefits. Seniors, from the numbers that we looked at, only 34% of eligible seniors are participating in the program. That means that there's a lot more of them who could be getting assistance, but they're fighting, first dealing with the stigma, and also dealing with not trying to harm someone else. Another example is Latinos. Dr. Supplemental mentioned that we do a lot of work around reaching out to Latinos. And Latinos make up less than 15% of SNAP participants nationwide, less than 15%. And that means that more than a quarter of eligible Latinos are not participating in the program. Oftentimes, work that we've seen to reach Latinos follows this cookie-cutter approach. And what we have learned, again, through focus groups, interviews, meeting with people in churches and different types of agencies, we have learned that they have different barriers depending on where they're from, or their nationality. And we have also learned that just translating materials is not enough. We need to look at different outreach methods and look also at different outreach channels. And just to give an example of that is Puerto Ricans, Dominicans, South Americans, they all have different concerns around participating in the program. Many of the groups that we have talked to are concerned that applying for and receiving SNAP benefits will threaten their ability to stay in the United States. But that's not a concern for Puerto Ricans because they're U.S. citizens. Some of the other Latino groups that we've spoken with have shared fears that if they accept SNAP benefits, or even if it's known that they have applied for SNAP benefits, their children will be removed from the home. Or in some cases, there's a belief that by participating in the program, those children will be automatically drafted for the military services once they turn 18, just because at some point they accept their SNAP benefits. So we have staff that works very, very hard in the field trying to address these misconceptions and appease those fears and help them understand that this will not happen, and that this is something that they can tell their friends about and their family, that will not happen if they participate in the program. But in spite of those differences among different Latino groups, what our staff finds that applies to mostly everyone that we have talked to is that real fear of admitting that they do not have enough money to feed their family. Many of the parents that we speak to find it difficult to admit that what they see as a failure of their responsibility to feed their children. So again, there's also that educational component in trying to help them understand that applying for SNAP is the responsible thing to do. That if they're working 2 or 3 jobs and somehow they're not making enough money to buy groceries, then they should be applying for this benefit. And they are then providing for their children by participating in the program. One example of the work that we do to address that and get directly to people who need to hear this message, whether they're seniors or Latinos or part of another population segment, is through our work with community health centers. In collaboration with Massachusetts General Hospital and Harvard Medical School, Project Bread piloted a food insecurity and outreach project quite a few years ago. And we learned through this project that families that are screened by a medical professional are more likely to understand that connection between health and adequate nutrition. And what we were doing was very simple, asking a parent a simple question during well-child visits. And it was a question similar to this: in the past month, was there a day when you or anyone in your family went hungry because you did not have enough money for food? And we found that parents were more likely to answer that question truthfully if they had a medical professional asking it than a social services person. And once that question was asked and an answer was given, then that allowed that medical staff to be able to have a conversation about food stamps or SNAP, as the name has changed, and be able to tell that family that by participating in the program, they would be able to afford more of that healthy food that their family needed. Families that were screened as food insecure or hungry then received what we call a prescription for health. And that included an emergency food voucher that was used to buy fruits and vegetables, and also a referral to talk to one of our outreach staff members who was located or stationed at that health center. They would help them fill out the SNAP application and stay with them during the application process to make sure that they were successfully enrolled. The project was so successful in identifying families in need and also in increasing SNAP participation rates for that health center went up from 28% to 63% over any month period. That Project Bread decided to then implement this project in over 30 health centers, and at this point we have 33 health centers where the project is running. And in some cases it's become institutionalized to the point where this is a regular part of the patient screening model. For millions of low-income families and individuals, having access to SNAP benefits can really make a difference between living with food insecurity or having access or being able to buy the food that they need for healthy development and healthy growth. And oftentimes we talk about the cost of a healthy diet or the cost of this program to taxpayers, but the real cost is the lives of children who are not able to develop as they should, whose present and future is threatened by not having access to food that will allow them to perform as they should, physically, mentally, and academically. So again, thank you so much for the opportunity to be here today and talk to you a little bit about some of the families that we work with, some of the stories that we hear, and being able to put some faces to the numbers that we hear about. Thank you.